I'm going to be demonstrating how to perform CPR for my demonstrative speech in my oral communication class. And this right here is my audience. As we all know, CPR is an emergency procedure. Statistics today show that approximately 90% of all out-of-hospital cardiac arrest victims will not survive. Their event needs to be witnessed by bystanders, or they need to be found within seconds of collapsing and going unresponsive. High-quality CPR at a rate of 100 to 120 chest compressions per minute must be started immediately to keep oxygenated blood flowing to their brain. However, when someone experiences sudden cardiac arrest, the only thing that will set their heart back into normal rhythm is the shock from a defibrillator. CPR must be used with an AED to improve the chances of survival. The steps you would perform in order to start CPR, or whenever you find an unresponsive victim: you want to assess the scene for safety to make sure everything's good so you don't get hurt or the patient doesn't get hurt. You want to check the person for responsiveness by tapping on the victim's shoulder and shouting, "Are you okay?" Look to see if the victim is breathing by watching to see if the chest rises and falls. You need to call 911. If you have somebody with you, have them call, or if you're alone, you call. You want to make sure the victim is lying on a firm and flat surface. Then you're going to start CPR on the victim if they are not breathing and unresponsive. For an adult, you must go 2 inches to 2.4 inches in the pushing in the chest. You want to do 100 to 120 compressions per minute. The ratio is 30 to 2, so 30 compressions to 2 rescue breaths. When you do the rescue breaths, you want to lean the head back, tilt the chin, and you want to either cover their nose and then do your 2 rescue breaths, or you can get a mask to do the rescue breaths with. Mouth to mouth is optional with an adult, but highly recommended for a child or infant. With a child, you're going to use 1 to 2 hands depending on the size of the child. You're going to push hard and fast, same as you would with an adult. The depth is 2 inches, and the ratio is 30 to 2 as well. On an infant, you're going to use 2 fingers. You would use your index and your middle finger, and you would go right above the sternum, and the depth is about 1.5 inches, and you would want to do 100 to 120 compressions per minute as well. You're going to cover the infant's mouth and nose with your mouth to form a complete seal, and then you're going to do your 2 rescue breaths. You got to remember the infant's lungs are much smaller than an adult, so don't do a full breath because they will fill up pretty quick. And I'm going to demonstrate how to do CPR on my victim right here. So I would assess the scene to make sure everything is safe, that I'm not going to get hurt or my victim's not going to be in danger. I'm going to check to see if they're okay. Are you okay? Are you okay? I'm going to check to see if they got a pulse. And I'm going to check to see if they're breathing by watching their chest rise and fall. And she's not breathing, so I am going to have somebody call 911, and then I'm going to go ahead and start CPR. I would locate where her breastbone is, the bottom of it, like where the lungs end and kind of goes midline to the axillary areas. So I put my palm down like this, and then I put the other on top, and so I'd start my chest compressions. I would do 30 of these. I would want to push hard and fast, and then I would tilt her head back, pinch her nose, and then breathe in 2 rescue breaths, and then I would go back to doing my chest compressions, and then do my 2 rescue breaths. You want to do at least 100 to 120 chest compressions in a minute, and then you would do your CPR until emergency responders respond, and then they take it from there.